Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. One of the most common conditions that we see at the Hauser Neck Center is nausea. All of us know what it's like to be nauseated, and nausea is a very, very serious symptom, especially if it's chronic. So when someone comes in with nausea, one of the first things that we'll ask them is, does food affect your nausea? And remember, I'm talking about chronic nausea. So when the person answers yes, normally when we test them, we find vagus nerve degeneration. When vagus nerve degeneration is from a breakdown of the neck curve or ligamentous cervical instability, we call that cervical vagopathy or Hauser's disease. And the nausea is because the body has a difficult time breaking down the food. So we all know if food just sits in the stomach, basically you're going to get nauseated. Now, when food doesn't affect nausea, we normally find that the cause of the nausea is internal jugular vein compression causing intracranial hypertension. And if you look on Google or YouTube and you look at what are the risk factors of intracranial hypertension, you're going to see that one of the risk factors for idiopathic intracranial hypertension is obesity. So obviously, if somebody's obese and they have intracranial hypertension, food really isn't affecting their nausea. I'm not saying this is 100%, but that's one of the risk factors. We all know, like compression, traumatic brain injuries, a common symptom of like post-whiplash syndrome or post-concussion syndrome is nausea or dizziness. When you have a whiplash or when you have a concussion, even when the head hits something, normally the head hits something, then there's a twist. So when there's a twist, it injures the upper cervical ligament. So you end up with upper cervical ligament injury. We document that by a process called digital motion X-ray. So MRIs that when you're laying down can often miss upper cervical instability, because how would you know that a cabinet door is loose unless you move it and you feel the jingling? Now, when people see us, they've already ruled out the other causes of nausea. We know there's a million different causes of nausea. A gazillion medications, there's a list here, disorders of the gut, endocrine problems, and labyrinth problems, which is the vestibular nerve, which we call vestibular dysfunction, like Meniere's disease, which can be from ligamentous cervical instability. Normally, I'm seeing, or the office here is seeing, ligamentous cervical instability-induced nausea. So upper cervical instability can cause increased tension or stretch on the nausea center in the brainstem, which is in the medulla. The medulla is just above the cervical spine. Head pressure, when head pressure is high, that's also termed pseudotumor cerebri. When the upper cervical instability causes the jugular veins to compress, that can increase brain pressure because the fluid can't get out of the brain. That can cause nausea. A cerebral spinal fluid leak, that causes nausea, especially when you're upright. When the vagus nerve doesn't work well, it's degenerated, the stomach doesn't work, food just sits there, or food can't go from the stomach to the small intestine because the pyloric valve won't open. When the vagus nerve isn't working well, the sphincter of Oddi and the various sphincters in the digestive tract, the gallbladder, the pancreas, all these different sphincters, they don't work so well. When the ileocecal valve doesn't work so well because of cervical vagopathy, bacteria from the large intestine go in the small intestine causing SIBO, that can cause nausea. Cervical vagopathy can lead to leaky gut, that can cause nausea. Dysautonomia can cause nausea. So upper cervical instability has lots of different ways to cause nausea, and this kind of shows it. Like ligamentous cervical instability can screw up the eustachian tube, which drains the inner ear. So then, because the pressure that's sensing on this inner ear versus this one is off, you can get motion sickness, you get motion and sickness induced nausea. Leaky gut can cause food sensitivities, which cause nausea. Small bowel overgrowth causes nausea. Decreased stomach acid secretion because the vagus nerve isn't stimulating the stomach. Without the vagus nerve, it's difficult, or without vagal nerve inputs, it's difficult for the stomach to secrete stomach acids. So again, food's just going to sit there or not get digested, so that's going to give nausea. Kinking of the brain stem, which is often from ligamentous upper cervical instability, causes nausea. Increased brain pressure can cause vestibular neuritis, Meniere's disease, can block cerebral spinal fluid, again causing nausea. Dysautonomia can cause nausea because there's just poor balance. The vestibular reflexes, the cervical reflexes, the visual reflexes are all screwed up. Meaning that, think about like you're just playing around with your kids, playing, like throwing a football, running around the yard. Like there has to be a coordinated effort between what you're seeing and your 3D perception of your head that your brain is sensing, as well as what's going on in the other body parts. So when you have ligamentous cervical instability, the proprioceptors in your neck, which tell the brain how your neck, body, and head are in 3D space, they don't work well. So you just get nauseated and you feel lightheaded, dizzy, especially when you're upright or you're in a moving vehicle, like you're in the car. I have lots of patients who they just can't be in a car because of these mechanisms. Sometimes people will go to an ENT doctor and they'll say you have vestibular dysfunction. If you've been diagnosed with that or Meniere's disease, I tell you, get an evaluation for cervical instability or a breakdown of the cervical curve, and probably you'll end up seeing that you actually have cervical-induced vestibular dysfunction, cervical-induced Meniere's disease, ligamentous cervical instability-induced nausea, basically. And then this is what it looks like. This is a model showing that the jugular vein normally gets compressed at the atlas. Traditionally, this is found by CT venogram, but we do ultrasound evaluation. I've done lots of videos on ultrasound evaluations of the jugular vein. So you can, with an ultrasound, you can screen with different neck positions that the jugular veins getting compressed. So if the upper cervical vertebrae are loose, they're unstable, and you'd say, well, doc, how would I know that? Well, if you have like a tension up here at the cranial cervical junction where the head hits the cervical spine, like it's tense there all the time, like it won't go away, that's the muscles contracting to stop the atlas from going forward to protect the vagus nerve and the internal jugular vein. So that's one sign. Another sign is, you feel like you always got to crack your neck, or you have clicking, popping, grinding up here. That's another sign that you have upper cervical instability. So to resolve the nausea, you have to get the upper cervical instability resolved, and we do that by prolotherapy. This just kind of shows that, see where it says vagal afferent, so the vagus nerve. This is one of the places in the medulla where there's nuclei of the vagus nerve. So the vagus nerve starts from the medulla. So we have the cervical spine here, like we have the cervical spine here, then it goes into the medulla where the nausea center is, and the vagus nerve can be involved with nausea. The vagus nerve is involved in your nausea when you just feel like you get bloated easily with food, and you have to be so careful with food. I recently had a patient that's lost something like 52 pounds, a female that's lost 52 pounds, just because of this mechanism. Because if food gets you really nauseated, you stop eating basically, or you can't eat. And then And then when the vagus nerve is degenerated, you have a difficult time even absorbing food. There's lots of different biological mechanisms for why people get nauseated, but I just want you to see where it says vagal mediated, vagal mediated. So vagal mediated is gastric dysrhythmias, meaning that the stomach doesn't have coordinated contraction to digest food, to break it down. And then autonomic nervous system responses, like the autonomic nervous system is imbalanced, meaning that there's too much sympathetic tone, not enough parasympathetic tone. So someone who says, yeah, absolutely, when I'm anxious or stressed, my nausea is so much better, that normally means that the vagus nerve is involved in the nausea. So you got to get the vagus nerve improved. So this just shows where the visual cortex, the vestibular system, the vagus nerve, like they all can be involved with nausea. So because the vagus nerve and the jugular veins run together, the same process can injure both of them. And I'm not saying the only cause of nausea is structural, but normally by the time we see patients at Caring Medical, the patient has tried to stop different medicines, they've changed their diet, they've worked on a lot of things, but yet the nausea remains. And then when we find upper cervical instability by digital motion X-ray and vagus nerve degeneration, when we correct those things with cervical curve correction, having the computer high, figuring out what position a person has to sleep in to open up the jugular veins, and the cervical instability is resolved with prolotherapy or helped with prolotherapy, then the nausea gets much, much, much better. One of the signs that the person has nausea that's related to the neck is motion sickness. So like I said, we have people who never had car sicknesses, like when they're driving, they get really nauseated. Or there's people that would say to us that they feel like they're on a boat, even they're on land. That's also called Mel-Debarkman syndrome. We find that it also is from ligamentous cervical instability. And if a person closes their eyes and the nausea gets better compared to opening up their eyes, we find that also is from the visual reflexes coordinated with the neck are off. So that also is from ligamentous cervical instability. So by correcting the misalignments, correcting the cervical curve and the other curves, correcting the instability, then the nausea gradually over time gets resolved.